Hello, my name is Dr. Roman, and today we're discussing oral sedation. So what is oral sedation? Oral sedation is when you're prescribed a little bit of medication to be taken about an hour before your procedure. Typically, we prescribe something called triazolam or Halcyon. You may have heard of these medications before. This medication will get you relaxed and sedated to a certain degree. You'll still be able to move around and to respond to your doctor, but you may or may not remember this procedure. This is called oral sedation, that when we issue you medications to be taken 1 hour before a procedure begins. Will you be asleep with this medication on board? Mixed results. I have seen people be totally out and snoring in the chair. I have seen people not be out. They're totally present and you can talk to them, but they say it's like, wow, I've had a glass or two of wine and I feel more relaxed. And those are both valid experiences for the same dosage and the same amount of time with medication on board, and you get two different people that respond completely differently. Will you remember the procedure with oral sedation? Again, it really depends on your anatomy and on your habits. Do you drink on a daily basis? Do you smoke pot? Or do you have other things? Do you take drugs recreationally? And those are the things that will sort of give us a hint whether we need more dosage or less dosage, depending on what you tell us. But typically results vary from person to person, and it's hard to predict with oral sedation the experience that you are going to have specifically. So if we can't predict this medication very well, is it safe? Yes, it is safe. And the reason why it is safe, because Halcyon, it doesn't impact your breathing. Yes, it impacts how you perceive reality. So whether you're relaxed to the point of snoring in the chair, or you're relaxed to the point where, oh, it feels like I've had a glass of wine or two. That's kind of the extent of what you can expect to feel from this particular medication. When it comes to breathing, it is totally safe and it won't impact the way you breathe in the chair. So yes, this medication is extremely safe, and provided it is used in a professional setting, nothing pretty much can go wrong. So if it's so safe, can you drive yourself home? Again, no, you may not get behind a wheel with this on board because you are impaired. You will not form very good memories, and even if you do, if you get stopped along the way, this will be an equivalent of DUI, and potentially I will get in trouble if I let you drive with this medication on board. So we always recommend to have somebody drop you off and pick you up after the procedure. Can you eat before this particular mode of sedation? So here are the differences. If we're doing IV sedation, you may not eat for 8 hours. We prefer that you fast. With this medication on board, I prefer that you fast generally, even though people say that you can consume a little bit of food before your procedure. The reason why I want you to have an empty stomach, so maybe about 4 hours of fasting before a procedure, is because when you don't have food inside your stomach, you can absorb that medication a lot more predictably. So let's say you just have eaten a big burrito and there's a bunch of food in there, and you toss in a little bit of sedative medication on top. Well, we really have no idea when that medication will be absorbed because there's so much food in the way. But what happens if you have an empty stomach? As soon as you take that medication, yes, there's maybe 30 to 40 minutes lag before that medication fully kicks in. So we can almost time it perfectly. That way, the sedation cycle is more predictable. So yes, I tell my patients, please have nothing in your stomach. Ideally, fast for about 4 hours before consuming this medication. Can you take your normal medications with this sedative? Yes, unless you are taking a different anti-anxiety or a different sedative along with this prescribed one. So if you have an anti-anxiety pill that you take on a daily basis, I'd say skip the anti-anxiety and take the sedative medication that I have given you just for today. As soon as this wears off, you can go back to taking your anti-anxiety medication. However, if it's something for blood pressure or a diuretic, of course we want you to take those things just like you usually do. Will you still be numbed even though you're orally sedated? Absolutely. We want you to feel nothing and be perfectly comfortable while you're here at Pacific Park Family Dental. This is why we will numb you for every single procedure. And if you feel like you're not numb enough, I will listen very closely to you and respond based on what you tell me. So one rule we have at Pacific Park Family Dental, nobody gets worked on if they're not numb. And that's held across the board, and we never have people that complain that they were not numb enough for procedures. This is something that just doesn't happen in our clinic. Who's not a good candidate for oral sedation? Now, typically people who are extremely nervous and they have history of oral sedation or laughing gas sedation is not working very well. Those are the people that need a little bit more sedation, and we just tell them outright. For example, there's a story behind this. I have met with a patient and I've seen that they're very nervous. So what we did, because they were this nervous, we gave them oral sedation, but we also added intravenous sedation for greater depth of sedation and greater control. If I were to do my anesthetic numbing just with oral sedation on board, that patient would not have been able to handle it. But because we were able to sedate her intravenously, all of a sudden numbing was not an issue and we were able to complete our procedure just as scheduled. How will you feel afterward? Well, it's just like any other substance that you may find yourself with. Yes, you may feel a little fuzzy or very relaxed or even sleepy while under the influence of this particular medication. But once that wears off, usually there's no remaining symptoms. It's just you're not relaxed anymore. And that's usually what people tell me. This was Dr. Roman at Pacific Park Family Dental discussing oral sedation with you. If you have any more questions or you think you want to talk to me directly, please give us a call and we'll be more than happy to meet with you one-on-one.